Hello. We're going to get this started. All right. First, I need an approval of the minutes of the March 28th meeting. Member Ricker, Member Daly, any corrections or additions? Seeing none, all those in favor, please state aye. Aye. Opposed? All right, we'll get right to the informational items. First, we have the Board of Health. Hello.
Good afternoon. In your packet, I'm sorry. In your packet, more than happy to answer any questions, but just wanted to highlight that for the East Bluff implementation for the Cure Violence funding we received from the city, we did award it to the PCAV to start that implementation process. In addition, there was 2 reports that we issued as part of our surveillance reports, the 2022 STI or sexually transmitted infection report, as well as our 2021 maternal and child health report. Did want to highlight in the maternal and child health report, we saw a decline in the number of infant mortalities from 2021 to 2020 to 2021. And I just wanted to highlight that we do a lot of partnerships, including the partnership with the Coroners Program to provide pack and plays to families. And then lastly, just a couple of things coming up. The agenda right now is summer camp. So our entire environmental health program will be out for summer camp over the weekend. We have a CDC training that's going to be available here the 1st and 2nd of June. And while the declaration for the pandemic is over, we are still working with our healthcare facilities in terms of changes in guidance, just because we are still waiting for CMS and HHS to provide additional guidance changes as it relates to healthcare providers. More than happy to answer any questions.
Great, thank you. Anybody have any questions for Monica? All right, are you going to stay here for care and treatment?
I can.
Okay.
Care and Treatment awarded the $1.5 million. I believe there was a press release that listed out all the applicants. Again, very excited to be able to provide that support to community partners.
Yeah, that's awesome. Thank you. EMA.
As I mentioned earlier, there is a CDC training coming up on the 1st and 2nd, as well as additional trainings in terms of kind of high target potential areas. And so we are working to develop those, and hopefully you've been receiving emails from Jason Marks along with just routine maintenance of our siren systems.
Great. Thank you very much. Next, we have the Regional Office of Education. Welcome.
Good afternoon, everyone. I'm trying to do a better job of getting reports submitted and getting it in your packet, so I think you got that this time. I just want to let you know that our mission at the Regional Office of Education is service to students, educators, and communities in that order, and we take that very seriously. So some of the things we've got going on this summer we're very excited about. Our new professional learning that we're offering is just, our new team is outstanding, and it's expanding so much in the county that we're having our districts willing to engage with us on a continuous improvement process, looking at data, looking at attendance, looking at grades, looking at testing, looking at all the components of a school to look for gaps and what we can do, because we've got a lot of post-COVID needs that we need to be addressing. And so we're very, very excited about that. We're bringing on some new team members to help us address that out in the county. For example, just met with Pleasant Hill yesterday and are putting some things in place for them. And then in the community, serving on some boards to help support their strategic missions that align with ours. Also part of service to our students, the GMB. Oh my goodness. You know, you're so excited when it starts, but it's so glad to be over too. I'm not gonna lie about it. But it was so dynamic this year, just the energy out there on the courthouse grounds, very exciting. The kids were just showcasing their talents. Thank you to everyone that came, that supported the food trucks, that supported the students. Thank you so much for being there. And some of the departments here in the county, the sheriff's office, our deepest gratitude. You were visibly present, making sure that things were safe. And just thank you very, very much. And one last thing I wanted to let you know, because we didn't have anything else to do. So we had a petition submitted to our office for an annexation and detachment. You might have read about it in the Journal Star. So that has been submitted to our office, and we are engaging in that process, and we are under working with state's attorney, and Jenny is supporting our office in those endeavors. It is outlined in school code of what we need to do, but that does flow through our office, and we will be getting that taken care of. But that is something that could continually be in the news media, so I just wanted to make you aware that we are engaging in that process. And beyond that, school's almost over. It's hard to believe we have completed another year, and all of our 2023 graduates are off to great things. Peoria Regional graduated 9 kids last week. So, any questions for me? Yes, very exciting, because they were 9 students that would not have graduated from their home high school if they did not get this second chance.
Any questions? I do have to give half of the credit of the day that I sponsored to member Coates.
Oh, okay. We will make sure to give that shout out,
Yes.
because that was such a wonderful day. It really was.
She gave me a check. She's good, so she gets half the
we
credit
will
now.
be adding you to our website. Those are the things that make it happen, because when the kids come down, you want them to have quality sound, you want them to have risers and chairs, and all of that matters to stage it in a more professional way. And so every single dollar matters, and we appreciate it deeply.
And again, Dave Poles was amazing. So
Director of Special Projects, Mr. Dave Poles, duties as assigned. And he's awesome.
thank you so much. All right, next, get back to the front here. Sustainability.
You want me to give Becca's report first? Sorry, Mr. Chairman, I think she shared with you an email earlier today that she was unable to be here today. A couple of quick points under sustainability and landfill. Household hazardous waste collection event. The registration is currently around 400 participants. It is June 10th. It is by appointment, so you can do that at peoriacounty.gov/recycle. Second, Becca had requested from EPA a local government tire collection event, and that was approved. The local government tire collection event will be July 11th. On the landfill committee, landfill meets tomorrow afternoon. Ms. Williams, as one of your appointed representatives, I'm sure will be there. Last month, the landfill committee learned about the discovery of an abandoned mine under where landfill 3 is going to go, and we're essentially ready to start building landfill number 3, or I should say GFL is. And I know last week, and we'll learn tomorrow, I'm sure, what became of a meeting at Illinois EPA regarding this new discovery and what impact that may or may not have on landfill number 3. Happy to answer any questions.
Thank you. Does anybody have any questions? Okay. And finally, we have, we're a month late for our quarterly update from the Center for Prevention of Abuse on our long-term care ombudsman program. Thank you guys for coming. Sorry we didn't have a meeting last month.
No problem. My name is Kevin Nolan. I'm from the Center for Prevention of Abuse, and I'm happy to introduce John Worsham, who's taken over as the regional ombudsman for the center. So I'm going to turn it over to John.
Good afternoon. We're really proud of the progress that our group has made during this calendar year. We've got some amazing numbers to share with you. Comparing this first quarter to last year, we've seen a 134% increase in the number of family members and residents that we've been able to educate about resident rights. A 671% increase in the number of closed cases that our ombudsmen have been able to work on regarding resident rights being violated by county facilities. 135% increase in the number of resident council meetings. That's where we attend meetings in the facility that involve the residents themselves interacting with the staff. A 70% increase in the number of staff members educated about our program and the rights of their residents. An 800% increase in the number of referrals that we've been able to provide to residents about services that are available to them outside of our agency and outside of their facility, and a 245% increase in the number of routine visits that are made by our ombudsman to ensure the facilities are in compliance with Illinois Department of Public Health regulations, and also to check up on our residents regularly. We're seeing a few trends in our facility. Number one, trend of involuntary discharges, facilities illegally discharging residents from their home. And that's exactly what a long-term facility is. It's their home. They live there. We continue to educate staff and administration about the proper protocol to initiate a discharge, to handle it legally and properly. This quarter, we also started educating hospital staff on nursing home discharge policy to combat what we call hospital dumping. That's when a nursing home drops someone off at the emergency room and says, they're your problem now. Well, that's illegal, but it happens. We see a trend of, in supportive living, we have facilities that are not refilling residents' prescriptions promptly. We've had residents that have done without medication for up to 10 days during this last quarter. And we're talking medications such as psychotropic medications, heart medications, lung medications. In one instance, we had a resident that had to be hospitalized with a urinary tract infection due to not receiving an antibiotic that cost under $10. That's just not acceptable. We've educated facilities on planning in advance for these medication reorders. We've educated the hospitals on how to file a complaint with Department of Public Health for this type of medication mismanagement. And finally, we've educated family members to pay attention to and to advocate for their residents in regard to their medication and how to get hold of us so that we can help in the process. Over the last quarter, we've had many successes, but I wanted to share this one with you. We're really proud of this. A resident at a Peoria in the Heights wanted to get a part-time job as a way to reconnect in the community, but the residents, family, and staff refused to consider the possibility for whatever reason. With permission from the resident, our ombudsman requested a care plan meeting, which resulted in this resident getting a job coach. And as a result of that, the resident's guardian allowed the resident to pursue the goal. Well, ultimately, the resident obtained a part-time job and has been able to move out of that skilled nursing center into an independent living center. And this resident now has money to do the things that are important to him. And we appreciate your support in helping us to get this job done. Thank you.
Fantastic. Thank you for advocating for our seniors and their families.
Yes, sir.
And just to be clear, the violations were in facilities within Peoria County, not
Yes, sir.
Peoria County
That is
facilities.
correct.
Okay. Just wanted to make sure.
Yes, sir.
There's a difference here.
Yes, absolutely. Everything I've
Right.
talked about was Peoria County.
Sure. Thank you. Does anybody have any questions? All right. Thank you very much. I appreciate it.
Yes, sir. Thank you.
Next, we have public comment. Does anybody have any public comment? Miscellaneous. Do we have an update on the health campus? I know Terry had sent me some information I could share.
Why don't you do that, Mr. Chairman, and I'll fill in any blanks.
Okay. So, Terry had sent me an email saying that currently abatement is going on in the facility. So, the work site is restricted. You can't go into the building now unless you're in full PPE. Abatement will be quickly followed by the decommission of several systems where refrigerants and hydraulic oils are needed to be removed prior to demolition, the HVAC and the elevator specifically. And the contractors and suppliers are currently ordering materials a lot of them, they're anticipating long wait times to get those in, so they're trying to get their orders in early. They kind of have, looks like maybe early June is their next meeting, and maybe early June is going to be scheduled for demolition sometime. So.
The only thing I would add is the single-family dwelling that's on the far south side of the property, that will actually come down first, but the ceremonial demolition that many team members that have spent their entire career in the health department, Board of Health members, maybe some of you are interested in, that'll be the main building, and we're working on something that will make sure everybody knows when that date is.
And that's going to be Monica with a sledgehammer, right? No?
Probably.
She's gone. Okay. All right. Seeing nothing else, we're adjourned. Thank you.